The drug protamine sulphate, and very important emergency drug a medicine resident should be aware of. What is this used for? The drug, you always use it whenever there is a excessive bleeding. In nephrology, after the dialysis, especially if the patient have received heparin, there is a chance there might be bleeding from the AV fistula or from the catheter side. The patient might bleed, or any bleed for that matter. Not only after dialysis, in any condition where the patient received heparin, subsequently if there is a bleeding, that time this drug protamine sulphate will be of immense helpful. What is the dose? 1 milligram of this protamine sulphate will neutralize an approximate about 100 international units of heparin. It's a simple calculation. The vial is available at 50 milligram dosage. Many might not have seen if you are in first year. Obviously, in your third year residency, definitely you are going to encounter this if you are a medicine resident working in a place where there is a 10 or more dialysis machines are there. So the calculation, the vial is available at 50 milligram formulation. 1 ml contains 10 milligram. Some vials might be 3 ml, but most of the vial in India which is available contains 5 ml, which is 50 milligram. So the protamine sulphate, it can be diluted in sterile water or in normal saline also. If you have to give as intravenous infusion, give it very slowly, over 10 to 15 minutes, because this might cause hypotension, sometimes allergic reaction also. And one more common clinical question is, they say, sir, heparin half-life is only 90 minutes. The patient received heparin around 4 hours back, still the patient is having bleeding. If the patient received heparin for some other reason, but if it is for dialysis, so dialysis got over around 4 hours back, but still the patient is having bleeding, it might not be heparin induced. See, theoretically, yes, T half is only 90 minutes, but practically it might not be 90 minutes, it might be more. It varies from patient to patient. So once you come to the clinical grounds, you have to think of heparin induced bleeding only, because the time varies between patient to patient. The 90 minutes protocol might help in multiple choice question, but not in the hospital setup. You have to keep your eyes wide open to catch the differential. If there is no other differential for bleeding, rather than waiting for PTINR, if the patient received heparin in the recent past, start protamine sulphate. As I told, give slowly 50 milligram. Theoretical calculation, protamine sulphate 1 milligram neutralizes 100 international unit of heparin. Obviously, during dialysis, the patient might have approximately received around, if the dose prescribed for that particular patient, let us take for an example, for the ease of calculation, let us take it as 1000 international unit the patient have received. So 1 milligram is neutralizing 100 international unit. So 10 milligram will neutralize 1000 international unit. But in dialysis, most of the time patient might have received 5000 international units of heparin. So obviously you have to give 50 milligram of protamine sulphate. 50 milligram of protamine sulphate, better to dilute in sterile water or normal saline, and give a special instruction to the staff to give it very slowly. Otherwise, in the ward, they might think this as a usual injection and might give as a bolus dose, which might lead to hypotension. If AV fistula is there, atriovenous fistula, if it is there, the patient might lose the fistula if the BP drops. This is for the nephrology residents. For others, hypotension itself is a side effect. So make sure the patient receives the injection at a slower rate, over 10 to 20 minutes. Next question. So when to repeat the injection? Suppose if the patient bleeding have reduced but still persistent, you can repeat it after 3 to 4 hours also. because the response came, yes, the patient might require more dose you can give after 3 hours, but just calculate how much heparin the patient have received. Another question, what is the mechanism? It basically binds the heparin and neutralizes its action. So these are the practical scenario for giving protamine sulfate in the ward. Practical info which is required to start protamine sulfate. So I hope next time whenever there is a bleeding, apart from sending PTINR, always ask the history and keep this drug in the backup. In the next video, we'll see regarding another drug. Till then, bye-bye.